Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments. Gentle skin care is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers, and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin's surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated product.
Hello, and welcome to this restful space. Take a moment to breathe deeply and settle in. Today we're going to explore something essential yet often overlooked: how what you put into your body affects the health and appearance of your skin. Your skin is your body's largest organ. It's not separate from the rest of you. It's deeply connected to your overall health, your nutrition, your hydration, and your internal well-being. While topical skincare products are valuable, they work best when supported by healthy habits from within. Let's begin with water, the foundation of life and of healthy skin. Your body is approximately 60% water. Your skin, particularly the deeper layers, contains a significant amount of water. This water is essential for every cellular process, for delivering nutrients to your skin cells, for maintaining your skin's plumpness and elasticity, and for flushing out toxins. When you're dehydrated, your skin shows it. Dehydrated skin looks dull and feels tight. Fine lines appear more prominent. Your skin may feel rough or flaky. In severe dehydration, your skin loses elasticity. When you pinch it gently, it doesn't spring back as quickly as it should. So how much water should you drink? The old 8 glasses a day rule is a reasonable guideline, but your actual needs depend on many factors: your body size, your activity level, the climate you live in, and your overall health. A more personalized approach is to pay attention to your thirst and the color of your urine. If you're thirsty, drink. If your urine is dark yellow, you need more water. Pale yellow is ideal. Drink water consistently throughout the day rather than trying to gulp down large amounts all at once. Your body can only absorb so much at a time, and steady hydration is more effective than sporadic large intakes. Start your day with a glass of water. Keep water nearby as you work or go about your activities. If you find plain water boring, add slices of lemon, cucumber, or fresh herbs for natural flavor. Herbal teas count toward your hydration as well. But here's an important nuance. Drinking water alone won't magically perfect your skin. If you're already adequately hydrated, if you're drinking when thirsty and your urine is pale yellow, Drinking more and more water won't provide additional benefits. Your skin can only hold so much water, and any excess is simply eliminated. What matters is consistent, adequate hydration combined with products that help your skin retain that moisture. This is where topical hydrators like hyaluronic acid come in. They help your skin hold on to the water you're providing from within. Now let's talk about diet and skin health. This is where things become both fascinating and complex. The relationship between diet and skin is real but nuanced. No single food will transform your skin overnight, and no single food is likely ruining your skin either. What matters is your overall dietary pattern over time. Let's explore nutrients that support skin health. Omega-3 fatty acids help maintain your skin's lipid barrier, which keeps moisture in and irritants out. They also have anti-inflammatory properties that can help with conditions like acne and rosacea. You'll find omega-3s in fatty fish like salmon, mackerel, and sardines, as well as in walnuts, flax seeds, and chia seeds. Aim to include these foods regularly in your diet. Antioxidants protect your skin from free radical damage caused by sun exposure, pollution, and normal metabolism. Vitamin C and E are powerful antioxidants. Vitamin C also supports collagen production. You'll find vitamin C in citrus fruits, berries, bell peppers, and leafy greens. Vitamin E is abundant in nuts, seeds, and avocados. Vitamin A supports skin cell production and repair. You'll find it in orange and yellow vegetables like carrots, sweet potatoes, and squash, as well as in dark leafy greens. Your body converts the beta-carotene in these foods into usable vitamin A. Zinc supports skin healing and helps control oil production. It's found in oysters, beef, pumpkin seeds, and lentils. If you struggle with acne or slow wound healing, ensuring adequate zinc intake might help. Protein provides the amino acids your body needs to produce collagen, elastin, and other structural proteins in your skin. Include adequate protein from sources like lean meats, fish, eggs, legumes, or tofu. Now let's address foods that might negatively affect your skin. The research here is less definitive and individual responses vary significantly, but certain patterns emerge. High glycemic foods, those that cause rapid spikes in blood sugar, may worsen acne for some people. This includes white bread, white rice, sugary snacks, and sweetened beverages. When blood sugar spikes, your body produces more insulin and androgens, which can increase oil production and inflammation. This doesn't mean you must eliminate all carbohydrates or sugar. It means choosing complex carbohydrates like whole grains, which release sugar more slowly, and moderating your intake of refined sugars and processed foods. Balance and moderation are key. Dairy, particularly skim milk, has been associated with acne in some studies. The hormones naturally present in milk might influence your own hormone levels and oil production. However, not everyone responds to dairy this way. If you suspect dairy affects your skin, try eliminating it for 4 to 6 weeks and observe whether your skin improves. If it does, you've identified a trigger. If it doesn't, dairy likely isn't an issue for you. Alcohol dehydrates your body and can dilate blood vessels, potentially worsening conditions like rosacea. It also taxes your liver, which plays a role in detoxification and skin health. Moderate consumption, 1 drink occasionally, is fine for most people, but excessive regular drinking can definitely impact your skin negatively. Highly processed foods often contain inflammatory oils, excessive salt, and artificial additives. While occasional consumption won't harm you, a diet dominated by processed foods doesn't provide the nutrients your skin needs and may promote inflammation throughout your body, including your skin. Here's what a skin-supportive diet looks like in practice. Plenty of colorful vegetables and fruits, adequate protein from varied sources, healthy fats from fish, nuts, seeds, and avocados, whole grains rather than refined carbohydrates, moderate amounts of dairy if you tolerate it well, limited processed foods and added sugars, and adequate water throughout the day. Notice that this is simply a generally healthy diet. There's no magic skin diet that differs dramatically from what supports your overall health. When you nourish your body well, your skin benefits along with everything else. Let's talk about supplements because many people wonder if they should take supplements for skin health. If you eat a varied, balanced diet, you probably don't need supplements specifically for your skin. However, certain deficiencies do affect skin health, and supplementation might be helpful in those cases. If you live in a northern climate, have darker skin, or spend little time outdoors, you might be deficient in vitamin D. Your doctor can test your levels. Vitamin D supports skin cell growth, repair, and metabolism. If you don't eat fish regularly, an omega-3 supplement might benefit your skin and overall health. Look for high-quality fish oil, or, if you're vegetarian, algae-based omega-3s. If you have diagnosed deficiencies in zinc, vitamin A, or other nutrients, supplementation under a doctor's guidance is appropriate. But don't take supplements speculatively or in megadoses. More isn't better, and some vitamins can be harmful in excess. Collagen supplements have become popular for skin health. The evidence is mixed. Some studies suggest they might improve skin hydration and elasticity, while others show minimal benefit. If you want to try collagen, look for hydrolyzed collagen peptides, which are more easily absorbed. But manage your expectations. Collagen supplements aren't miracle workers. Probiotics might benefit skin health indirectly by supporting gut health, which is connected to skin conditions like acne and rosacea for some people. However, the research is still emerging, and not everyone will see skin improvements from probiotics. Before taking any supplement, consider whether you might get the same nutrients from food instead. Supplements are meant to supplement a healthy diet, not replace it. And always inform your doctor about supplements you're taking, as they can interact with medications. Now let's discuss the gut-skin connection because this is an area of growing research and understanding. Your gut microbiome, the community of bacteria and other microorganisms in your digestive system, influences your overall health, including your skin. An imbalanced gut microbiome has been linked to inflammatory skin conditions like acne, rosacea, and eczema. Supporting your gut health may support your skin health. Here's how. Eat probiotic-rich foods like yogurt, kefir, sauerkraut, kimchi, and other fermented foods. These provide beneficial bacteria. Eat prebiotic-rich foods like garlic, onions, leeks, asparagus, and bananas. Prebiotics feed the good bacteria in your gut. Eat plenty of fiber from vegetables, fruits, and whole grains. Fiber supports healthy digestion and a diverse microbiome. Limit antibiotic use to when it's truly necessary, as antibiotics kill beneficial bacteria along with harmful ones. Manage stress, which can disrupt your gut microbiome. Again, these are practices that support overall health. The connection between gut and skin is one more reason to care for your whole body, not just your skin in isolation. Let's address a common question. Can food allergies or sensitivities cause skin problems? Yes, sometimes. True food allergies can cause hives, swelling, or rashes. Food sensitivities, which are different from allergies, might manifest as chronic skin issues like eczema or acne for some people. If you suspect a food is affecting your skin, the most reliable way to investigate is an elimination diet under the guidance of a healthcare provider. You remove the suspected food completely for several weeks, then reintroduce it while carefully monitoring your symptoms. This helps you identify true triggers versus coincidental correlations. Don't eliminate entire food groups based on speculation or unproven theories. This can lead to nutritional deficiencies and an unhealthy relationship with food. If you have concerns, work with a doctor or registered dietitian. As we come toward the close of our time together, let's remember the big picture. Your skin is part of your body, not separate from it. What supports your overall health supports your skin. Hydration, nutrition, gut health, sleep, stress management, all of these affect your skin along with every other part of you. You don't need a perfect diet to have healthy skin. You don't need expensive superfoods or restrictive elimination diets. You simply need to nourish yourself consistently and adequately with real, varied, whole foods and plenty of water. When you eat a varied diet rich in vegetables, fruits, whole grains, healthy proteins, and good fats, you're providing your skin with everything it needs to be healthy. When you stay adequately hydrated, you're supporting your skin's function and appearance. When you care for your gut health, you're potentially improving your skin along with your digestion and immunity. Topical skincare products are valuable tools, but they work best when supported by nourishment from within. Think of it as a partnership. Feed your skin from the inside with good nutrition and hydration. Care for it from the outside with appropriate products. Take a deep breath in and release. You now understand how hydration and nutrition support your skin health. May you nourish yourself with wisdom and without restriction. May you hydrate adequately and consistently. May you see your skin as part of your whole body, deserving of care from within and without. Thank you for this peaceful time together. Be well, nourish yourself, and trust that your body knows how to be healthy when you provide what it needs. Welcome, and take this moment to breathe deeply. Let yourself settle into peace. Today we're going to explore skincare for mature skin, understanding its unique needs and how to care for it with gentleness, respect, and effectiveness. Mature skin is beautiful. It tells the story of a life lived, experiences gained, wisdom earned. But it does have different needs than younger skin, and understanding these needs allows you to care for yourself optimally. As skin ages, several changes occur naturally. Let's explore these changes with understanding, not fear. First, your skin produces less oil. The sebaceous glands that produce sebum gradually slow down their production. This can lead to drier skin that feels less supple and may become more sensitive. The natural moisturizing factors in your skin also decrease, affecting your skin's ability to hold on to moisture. Second, cell turnover slows. When you're young, your skin cells renew approximately every 28 days. As you age, this process slows to 40, 50, or even 60 days. Dead cells linger longer on the surface, potentially create dullness and roughness. Third, collagen and elastin production decreases. These structural proteins give your skin its firmness and bounce. Starting in your 20s and accelerating through your 30s and beyond, your body produces less of these proteins. Existing collagen and elastin also break down from cumulative sun exposure and other environmental factors. This leads to fine lines, wrinkles, and loss of firmness. Fourth, your skin becomes thinner and more fragile. The epidermis and dermis both thin with age, making your skin more vulnerable to damage, slower to heal, and more likely to bruise. Fifth, fat loss in your face changes its contours. The fat pads that give youthful faces their fullness gradually diminish, leading to hollow areas and more pronounced facial structure. These changes are natural and universal. Every human who lives long enough experiences them. They're not failures or flaws, they're simply part of the aging process. However, how dramatically and quickly you age is partly within your control. Sun exposure is the single biggest factor in how your skin ages. Genetics play a role, but sun damage, smoking, diet, stress, and skincare habits all significantly impact how your skin ages. Let's talk about caring for mature skin with wisdom and effectiveness. The foundation remains the same: gentle cleansing, adequate moisture, and sun protection. But mature skin benefits from specific ingredients and extra attention. Cleansing for mature skin should be exceptionally gentle. Your skin is drier and more fragile than it once was. Harsh cleansers that strip away oil will leave your skin uncomfortable and compromised. Choose creamy, hydrating cleansers that clean without stripping. Oil cleansers or cleansing balms work beautifully for mature skin, providing gentle cleansing while leaving skin soft. You might find you don't need to cleanse morning and evening. Many people with mature skin do well with just water or micellar water in the morning, saving their full cleanse for evening. Listen to your skin. Hydration becomes increasingly important. With reduced natural moisture factors and decreased oil production, mature skin needs help maintaining adequate hydration. Hyaluronic acid becomes a valuable ally. It holds moisture in your skin, plumping fine lines and keeping your skin comfortable. Apply hyaluronic acid to damp skin, then seal it in with a rich moisturizer. Think layers: hydrating essence or serum, then moisturizer, possibly topped with a facial oil for extra nourishment and protection. Moisturizers for mature skin should be rich and nourishing. Look for products containing ceramides, which restore your barrier, peptides, which support collagen production, fatty acids, and occlusives that prevent moisture loss. Don't be afraid of richer creams. Your skin needs that nourishment now. Night creams are particularly valuable for mature skin. Richer than day moisturizers, they provide intensive overnight nourishment while your skin repairs itself. Now let's discuss active ingredients that specifically benefit mature skin. Retinoids are the gold standard for anti-aging. They increase cell turnover, stimulate collagen production, improve skin texture, reduce fine lines and wrinkles, and help fade dark spots. Retinoids essentially help your skin function more like younger skin. For mature skin, start with gentler retinoids, retinol or retinaldehyde, and build up slowly. Apply a pea-sized amount 2 to 3 times per week initially, gradually increasing frequency as your skin builds tolerance. Always use retinoids at night and follow with moisturizer. Your skin may be drier initially. This is normal and improves with continued use. Vitamin C is another powerhouse for mature skin. It's an antioxidant that protects against environmental damage, brightens skin tone, fades dark spots, and stimulates collagen production. Use vitamin C in the morning under sunscreen for daytime antioxidant protection. Niacinamide offers multiple benefits. It strengthens your barrier, reduces inflammation, evens skin tone, and may help with fine lines. It's gentle enough for even sensitive mature skin and works well with other ingredients. Peptides are chains of amino acids that signal your skin to produce more collagen. While research is still evolving, many peptide products show promise for improving firmness and reducing wrinkles. AHAs, alpha hydroxy acids, like glycolic or lactic acid, gently exfoliate, removing dead cells that linger due to slower cell turnover. This reveals brighter, smoother skin and enhances product absorption. For mature skin, use AHAs 1-2 times weekly with lower concentrations. Be gentle. Mature skin doesn't tolerate aggressive exfoliation. Well, antioxidants protect your skin from environmental damage that accelerates aging. Beyond vitamin C, look for ingredients like vitamin E, green tea extract, resveratrol, and coenzyme Q10. These neutralize free radicals before they can damage your skin cells. Sun protection is absolutely non-negotiable for mature skin. Every day, rain or shine, indoor or outdoor, UV radiation continues to damage your skin regardless of age, breaking down what collagen remains and creating new damage. Broad-spectrum SPF 30 minimum, reapplied as needed. This is the single most important anti-aging step you can take. Beyond topical skincare, consider these factors for healthy, mature skin. Hydration from within matters. Drink adequate water. Eat foods rich in antioxidants, healthy fats and vitamins. Omega-3 fatty acids from fish, flaxseed, or supplements support skin health from the inside. Sleep is when your skin repairs and regenerates. Prioritize 7 to 9 hours nightly. Consider a silk or satin pillowcase to reduce friction and prevent sleep lines. Stress management helps. Chronic stress accelerates aging through multiple pathways: inflammation, oxidative stress, and hormonal changes. Whatever helps you manage stress, meditation, exercise, hobbies, therapy, benefits your skin as much as your overall health. Gentle facial massage can support mature skin. As you apply your products, take time to massage gently with upward strokes. This stimulates circulation, encourages lymphatic drainage, and can help reduce puffiness while providing a moment of self-care. Don't neglect your neck, chest, and hands. These areas show age prominently but are often forgotten in skincare routines. Extend your facial skincare down your neck and chest. Apply hand cream with SPF throughout the day. Professional treatments can complement home care. Regular facials, chemical peels, microneedling, or laser treatments can address specific concerns. Work with a qualified esthetician or dermatologist who specializes in mature skin. Let's address expectations realistically. Skincare cannot reverse aging entirely. It cannot eliminate deep wrinkles, restore lost volume, or turn back time. What it can do is improve skin health, texture, and tone, minimize fine lines, even pigmentation, and help you age more gracefully. If you're hoping for dramatic transformation, you may be disappointed. But if you're hoping for healthier, more comfortable, brighter, smoother skin that reflects good care, that's absolutely achievable. Results take time, months, not weeks. Be patient and consistent. Some improvements you'll notice within weeks, better hydration, improved texture. But significant changes in wrinkles and firmness require months of dedicated care. Finally, let's talk about acceptance alongside action. Caring for your mature skin is valuable and worthwhile, but your worth isn't determined by how few wrinkles you have or how youthful your skin looks. Aging is a privilege denied to many. Your skin tells your story. Honor it while caring for it. Use skincare to support your skin's health and comfort, not to wage.
Licorice consumption can affect electrolytes and blood pressure. Selenium supplementation at moderate levels, 55 to 200 micrograms daily, might support skin health through antioxidant mechanisms. However, acne-specific benefits aren't well established, and excessive selenium causes toxicity. Important considerations for supplementation: supplements aren't regulated as rigorously as pharmaceuticals, meaning quality, purity, and actual content vary between brands. Third-party testing helps identify higher quality products. Supplements can interact with medications. Discuss supplementation with your healthcare provider, particularly if taking medications. Supplements take weeks to months to demonstrate benefits. Expecting rapid results leads to disappointment. Supplements work best supporting other treatments, not replacing proven acne treatments. Many people take ineffective supplements indefinitely while their acne worsens, when proven topical treatments would help. Finally, the supplement industry profits from marketing claims exceeding evidence. Skepticism is appropriate. Practical approach: implement proven lifestyle modifications, sleep, stress management, diet, and proven topical treatments first. If acne improvement plateaus, consider evidence-based supplementation like zinc, vitamin D, or omega-3s. Avoid high-dose, poorly studied supplements marketed with exaggerated claims. Guide 39: Acne in diverse skin types and ethnic considerations. Acne manifestation, treatment response, and complications vary across different skin types and ethnic backgrounds. Understanding these differences ensures appropriate, culturally informed acne management. Skin type classification using Fitzpatrick scale ranges from type 1, very fair, burns easily, to type 6, very dark, never burns. Acne occurs across all skin types, but manifestation and complication risks differ significantly. Post-inflammatory hyperpigmentation, PIH, is more prominent and persistent in darker skin types, types 4 to 6. While lighter skin types experience PIH that fades within 3 to 6 months, darker skin types often experience PIH persisting 6 to 12 months or longer. This makes PIH management particularly important for darker skin types. Aggressive sun protection, early treatment of active acne to minimize inflammation, and specific PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly important for darker skin. Post-inflammatory erythema, redness persisting after acne heals, is more prominent in lighter skin types, while PIH dominates in darker skin types. Understanding your skin type predisposes you to which complication helps target appropriate treatments. Acne scarring appears across all skin types, though manifestation differs. Hypertrophic scars, raised, thick scars, are more common in darker skin types, while atrophic scars, depressed scars, are more common in lighter skin types. Some darker skin types experience keloid scars, excessive scarring extending beyond original injury, requiring specific treatment approaches. Treatment tolerability varies by skin type. Benzoyl peroxide can appear white or chalky on very dark skin, making application inconvenient. Using micronized formulations or applying to clean, dry skin before any other products helps. Some people with darker skin prefer avoiding benzoyl peroxide entirely and using alternatives like salicylic acid or retinoids. Photosensitivity from retinoids and chemical exfoliants presents differently across skin types. While all skin types experience increased sun sensitivity, darker skin types experience more severe hyperpigmentation from sun exposure, making sun protection even more critical. Lighter skin types experience more severe sunburn from photosensitivity. Chemical peels require different approach across skin types. Superficial peels are generally safe for all skin types. However, medium depth and particularly deep peels carry higher complication risk in darker skin types, including post-inflammatory hyperpigmentation and abnormal pigmentation. Dermatologists experienced in treating darker skin types are preferable for deeper peels. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。こう、広しはその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に測った午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、コウの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはコウの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。コウは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、コウは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。失礼は現代的でありながら伝統への敬意を忘れていない若い世代がネオ懐石と呼ぶスタイルだ。何の用だ。威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、 白衣は刃物のようにパリッとしている。シェフ帽、トックはおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, acne resistant to standard topical treatments, particularly if inflammatory and deep, often reflects hormonal causes. Women with other hormonal symptoms, irregular periods, excessive hair growth, hair loss, fertility issues, should definitely pursue hormonal evaluation. Primary hormone involved in acne is androgen, particularly testosterone and DHT, dihydrotestosterone. However, most women with hormonal acne have normal total testosterone levels but exhibit heightened skin sensitivity to androgens. This explains why some women with normal hormones still have significant hormonal acne. It's about skin sensitivity, not absolute hormone levels. Relevant hormonal tests for acne evaluation include total testosterone, free testosterone, calculated or direct measurement, DHT, dihydrotestosterone, DHAS, dehydroepiandrosterone sulfate, LH, luteinizing hormone, FSH, follicle-stimulating hormone, and androstenedione. These tests assess androgen status and ovulatory function. Additionally, tests for other hormones affecting acne include estradiol, progesterone, tested in luteal phase for ovulation confirmation, cortisol, for stress-related endocrine effects, and thyroid function, TSH, free T4, may be relevant. Ovulatory dysfunction, present in conditions like PCOS, contributes to hormonal acne. PCOS involves elevated androgen production, irregular ovulation, and insulin resistance. Women with PCOS typically have irregular periods, acne, hirsutism, excessive hair growth, androgenetic alopecia, pattern hair loss, and often obesity. Testing for PCOS is appropriate for women with these symptoms. PCOS diagnosis requires ovulatory dysfunction, irregular periods, plus hyperandrogenism, elevated androgens or clinical signs, and/or polycystic ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ING/DL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why: medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oils.
Hello and welcome. Take a deep breath with me. In through your nose, out through your mouth. Let any tension dissolve as we settle into this peaceful space together. Today we're going to explore something fundamental: understanding your own skin. Your skin is unique to you. No one else has skin exactly like yours, with its particular combination of characteristics, needs, and behaviors. Understanding your skin type and specific concerns is the foundation of effective skincare. When you truly know your skin, you can choose products and treatments that actually work rather than following trends that might not serve you. Let's start by clarifying an important distinction: skin type versus skin concerns. Your skin type is your skin's natural baseline condition. It's relatively stable and doesn't change much over time. Skin concerns, on the other hand, are specific issues that can come and go, that can be addressed and improved with targeted care. First, let's explore the main skin types. Remember, very few people have just one pure skin type. Most of us are somewhere on a spectrum or have combination characteristics. That's completely normal. Normal skin is the baseline we compare everything to. If you have normal skin, you're fortunate. It means your skin is balanced, not too oily, not too dry. It feels comfortable throughout the day. Your pores are relatively small. You rarely experience breakouts or excessive dryness. Your skin tolerates most products well without becoming irritated. If this describes you, your main goal is maintenance, protecting your skin and keeping it balanced. And dry skin feels tight, especially after cleansing. It may look dull or flaky. Fine lines might be more visible because your skin lacks adequate moisture and oil. Your skin might feel uncomfortable, even itchy at times. In cold or dry weather, these symptoms often worsen. Dry skin needs rich, nourishing products that provide both hydration and oils to seal in moisture. Your skin's barrier function may be compromised, so strengthening and protecting it is essential. Oily skin produces excess sebum, giving your face a shiny appearance, especially in your T-zone, your forehead, nose, and chin. Your pores are typically more visible, and you're more prone to blackheads and breakouts. You might feel like your face needs washing multiple times a day. However, oily skin has advantages. It tends to age more slowly because the extra oil provides natural protection and moisture. The key is managing oil production without stripping your skin, which would only trigger more oil production. Combination skin is exactly what it sounds like, a combination of oily and dry. Typically, your T-zone is oily while your cheeks are normal to dry. This is actually one of the most common skin types. The challenge is addressing different needs in different areas. You might need lighter products for your T-zone and richer products for your cheeks, or you might find a balanced product that works well everywhere. Sensitive skin isn't actually a skin type in the traditional sense, but it's an important category. If you have sensitive skin, it means your skin reacts easily to products, environmental factors, or ingredients. You might experience redness, burning, stinging, or itching when using certain products. Your skin might be reactive to temperature changes, stress, or certain foods. Sensitive skin requires gentle, minimal ingredient products and careful patch testing of anything new. Now, how do you determine your skin type? Here's a simple test you can do at home. Cleanse your face gently with a mild cleanser. Pat dry and don't apply any products. Wait 1 hour, then examine your skin carefully. If your skin feels tight and looks dull, you have dry skin. If you see shine across your entire face, you have oily skin. If you see shine only in your T-zone while your cheeks feel comfortable, you have combination skin. If your skin feels comfortable all over without tightness or excessive shine, you have normal skin. This test isn't perfect, but it gives you a good starting point for understanding your skin's baseline behavior. Now let's move to skin concerns. These are specific issues that might affect any skin type. You can have oily skin with hyperpigmentation, or dry skin with acne, or any combination. Understanding your concerns helps you choose targeted treatments. Acne is a concern, not a skin type. While it's more common with oily skin, people with any skin type can experience breakouts. Acne requires targeted treatment with ingredients like salicylic acid, benzoyl peroxide, or retinoids, combined with gentle, non-comedogenic base products appropriate for your skin type. Hyperpigmentation refers to dark spots or patches on your skin. These can result from sun damage, acne scars, melasma, or inflammation. Ingredients like vitamin C, niacinamide, alpha-hydroxy acids, and retinoids can help fade hyperpigmentation over time. But the most crucial step is diligent sun protection. Without SPF, hyperpigmentation will continue to darken, and new spots will form. Dehydration is different from dryness. Dry skin lacks oil, while dehydrated skin lacks water. Any skin type, even oily skin, can be dehydrated. Dehydrated skin feels tight, looks dull, and fine lines may be more visible. The solution is hydrating products with humectants like hyaluronic acid, along with adequate water intake, and avoiding harsh products that strip moisture. Redness and rosacea fall on a spectrum from occasional flushing to persistent redness to the visible blood vessels and bumps of rosacea. Triggers can include temperature extremes, spicy foods, alcohol, stress, and certain skincare ingredients. Gentle products, barrier repair ingredients, and avoiding triggers are key. Sunscreen is essential as sun exposure can worsen redness. Large pores are a common concern, especially with oily skin. Pore size is largely genetic, and you cannot actually shrink pores permanently. However, you can minimize their appearance by keeping them clear with regular exfoliation and by keeping your skin well hydrated, which plumps the skin and makes pores less noticeable. Fine lines and wrinkles become more apparent as we age. Prevention through sun protection is most effective, but retinoids, peptides, and good hydration can improve their appearance over time. Texture concerns include roughness, bumps, or uneven skin. Regular gentle exfoliation, retinoids, and proper hydration can significantly improve texture over several weeks to months. Now, here's where understanding gets practical. Once you know your skin type and concerns, you can build a routine that addresses both. If you have dry skin with hyperpigmentation, you need rich, hydrating base products plus targeted brightening treatments. Your cleanser should be creamy and gentle. Your moisturizer should be rich. Your treatment products might include vitamin C serum and perhaps a gentle retinoid at night. And sunscreen is absolutely essential every day. If you have oily skin with acne, you need lightweight, oil-free products that won't clog your pores, plus acne-fighting ingredients. Your cleanser might contain salicylic acid. Your moisturizer should be gel-based or very light. Your treatment products might include benzoyl peroxide or retinoids. You still need moisturizer and sunscreen. Oily skin needs these too. If you have combination skin with sensitivity, you need balanced products that don't trigger reactions. Gentle, fragrance-free formulas are essential. You might use slightly different products on different areas of your face if needed. The key is addressing your skin type with your base routine, your cleanser, moisturizer, and sunscreen, and addressing your specific concerns with targeted treatments layered in appropriately. Your skin will also change with seasons, hormones, stress levels, and age. The oily skin you had in summer might become combination in winter. The dry skin you have now might become more normal once you establish a good routine. Stay attentive to these changes and adjust accordingly. Pay attention to how your skin feels and looks throughout the day. Does it feel tight an hour after cleansing? Your cleanser might be too harsh. Is your face shiny within a few hours of moisturizing? You might need a lighter product. Does your skin sting when you apply certain products? You might be sensitive to specific ingredients. Your skin is constantly communicating with you. Listen to it. Trust its signals. If something burns,
Hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53. Acne mechanica, friction and pressure-related acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing